Ladies and gentlemen, welcome. My name's Glen Hodgson. I'm part of the GS1 UK healthcare team, and it's my privilege to see so many of you here today. We have over 400 people registered over the 2 days. Over 40 NHS hospital trusts are here, and we're looking to be able to show and people coming to talk to you about and to share and to learn all around the benefits of GS1 to improve patient care. One of the things that we have that every one of us in the room, I was thinking about this morning, that every one of us in the room gets up to do every morning. The reason every one of us comes to work, whether we're supplying technology systems, whether we're a medical doctor, whether we're a chief exec of the hospital, or indeed you work for a standards organisation, the reason we all get up in the morning is to ensure better patient care. And today, this first session is going to give you a mixture of the national perspective from two national leaders and also some patient-specific journeys around patient safety. So we're going to hear from Professor Terence Stevenson why patient safety is very important to him and his personal story, and later we will hear from a patient as well. So I have a couple of things to do that are important before we kick off, and it is also a delight for me to say that the reason we're able to put this gathering together is because of the amount of sponsors that we have and indeed exhibitors upstairs. So I encourage you, please, to go and talk to the exhibitors. And a big thanks also to our platinum sponsor, Linsgo Systems, who have been very supportive of us throughout this process. So thank you very much for that. I think what we need to do also is I want to talk to you a little bit about the programme of today, again, so a little bit more detail. So first up, we're going to have Terence Stevenson. Professor Stevenson is with us for a very short period. He actually has to leave directly this morning because he has another meeting in London. We tried very, very hard, and he's very kindly given us his time today. Last year, if you remember, if you were here with us last year, he spent the whole 2 days with us. And then Alistair's going to stand up and give us his views on the wider healthcare environment. Anthony Bennett-Ant is going to give a patient view on why patient safety is important and why standards in healthcare is important. And then I'm delighted to have Matthew Swindells with us. So, as you know, Matthew Swindells is one of the leaders of NHS England, and he will be addressing us and then taking questions with Alistair afterwards. And then we'll have a break. Post the break, Bod Goddard is going to produce his clinical study results for us, and then we will have lunch. And then I'm delighted and actually honoured to say we've got 3 chief execs going to appear on the stage to tell you why it's important to them. So that's how the programme will look, and I'll give you some further updates on the programme and as we go forward. But let's kick off. And as I say, first onto the stage to address us is Professor Terence Stevenson. Terence is the chair of the General Medical Council. He's a paediatrician specialising in, obviously, paediatric medicine and paediatric emergency care. Nuffield Professor of Child Health at the UCLH and Great Ormond Street, and also, I'm delighted to say, a member of the GS1 UK Healthcare Advisory Board. Terence, welcome.